Hello, everyone, and thank you for your interest in the presentation on the plan benefits. I encourage you to familiarize yourself with the benefits and programs available to you and your employees through the local government health insurance board. In order to have a better understanding of our benefits, we think it's important to briefly explain how our benefits work. This slide is meant to give a quick walkthrough as to how our plan and our board operate. Our board administers our health insurance plan. The board meets annually to determine the premiums and benefits for the following year. The board also sets policies, negotiates contracts, and handles appeals that either units or members may submit. Our covered members utilize their benefits when they visit their providers to receive medical care. Usually, their portion of the medical care is to cover their copays, coinsurance, and deductibles. Providers include the doctors, hospitals, dentists, and pharmacies. When the employees visit the providers then send the claim information to the claims administrator, either Blue Cross and Blue Shield of Alabama for the health and dental benefits for active employees and non-Medicare retirees, and Optum Rx for the prescription drug benefits. Once the insurance company receives it, they pass the claims through their incredible discount network and send us the final claim to be paid. The local government health insurance plan has a robust benefit package to meet your needs through every stage of life. It encompasses medical, hospital, pharmacy, mental health, preventative services, and more, along with a vast network of providers to serve you. The plan has a low annual deductible of $200 that combines medical and pharmacy cost. Blue Cross and Blue Shield of Alabama manages our medical benefits, while our pharmacy benefits are managed by Optum Rx. The following scenarios of how benefits may be applied are only for example purposes. For additional detailed information, please refer to the LGHIB Plan Book located on our website. As I mentioned before, the local government health insurance plan has benefits to meet your needs through all stages of life. Let's start with an example of network benefits commonly used by healthy young adults. Teledoc is a free service for members of the local government plan that provides consultations with board-certified doctors via phone or video 24/7. Members can speak with a doctor about a variety of issues, such as allergies, infections, rashes, and more. When necessary, the doctor can even prescribe medications. This benefit can be used in place of the emergency room or urgent care clinics for non-emergency situations, saving you time and money. Download the Teledoc app or visit their website or call Teledoc to begin using this valuable benefit today. Preventative visits are covered at 100%. This includes services such as cancer screenings, annual physicals, and immunizations. Outpatient mental health as well as substance abuse services are available for a $14 per visit copay, up to 24 visits per year. Provider office visits are subject to a copay. Nurse practitioner and physician assistants are $20 per visit. Physician and DOs are $40 per visit, and specialists are a $50 per visit copay. Pregnancy and motherhood can be a stressful time, but you don't have to worry about your health care coverage, especially when you enroll in the Baby Yourself program through Blue Cross and Blue Shield. This is a free program, and it's valuable. Enroll in this program before the end of your second trimester to take advantage of support services, educational consultations with a nurse, free gifts, and to have your hospital and provider copays and deductibles waived. Once your bundle of joy has arrived, you can rest assured that the many immunizations and routine well baby visits are covered at 100% when using a network provider. Allergy testing and treatment is covered at 80%, and subject to the calendar year deductible. ABA therapy for children on the autism spectrum is subject to a $14 copay when performed by a network provider. But please note that a pre-certification is required prior to receiving this therapy. Should you have an unexpected event take place, whether an auto accident or your child falls off a skateboard, the local government health insurance plan has benefits to meet your needs. Ambulance services are covered at 80% and are subject to the calendar year deductible. Emergency room services are covered at 100% when provided within 72 hours of the accident. Diagnostic x-rays and surgery are both covered at 100% and are subject to a $100 facility copay. Physical therapy network benefits are covered at 80%, and they are also subject to the calendar year deductible. Continuing with examples from different stages of life, aging adults with chronic conditions may utilize these benefits. Inpatient hospital admissions are subject to a $200 admission deductible on the first day, $50 facility copay for days 2 through 5. Medical emergencies not related to an accidental injury have a $200 facility copay. Lab test will be $7.50 copay per test. Dialysis, chemotherapy, radiation, or infusion services are subject to a $25 facility copay. Durable medical equipment is covered at 80% and is subject to the calendar year deductible. Should you require home health, it's covered at 80%, subject to the calendar year deductible as well, but please note that pre-certification is required. Now let's review the prescription drug benefits available through the local government health insurance plan. Drugs on our formulary are assigned to different tiers. Tier 1 medications are our most common. These are the preferred generic drugs. These drugs have a maximum copay of $15 per fill, and generic maintenance drugs may be dispensed for up to a 60-day supply after that first initial 30-day fill. Tier 2 medications are preferred brand drugs. These medications are covered at 80% and are subject to a $200 calendar year deductible. Member pays the cost of the drug and then submits for up to 80% reimbursement through OptumRx. These medications may be dispensed for up to a 90-day supply. There is a $200 annual deductible, but remember, this can be a combination of medical and pharmacy cost. For prescriptions to count towards the deductible, you must first submit for reimbursement through OptumRx. Let's talk about how to do that. Brand name formulary medications for drugs in Tier 2 and 3, along with specialty medications, may be eligible for reimbursement. Create or log into your OptumRx user account and submit the reimbursement request electronically. Or you can print out a copy of the reimbursement form and submit by mail. Reimbursement checks will be mailed to the card holder's address on file. Please allow adequate time for processing. We are working on improving this process by shortening the turnaround time. Please be on the lookout for upcoming updates. Let's talk more about the tiers. Tier 3 drugs are set up similar to Tier 2. They are covered at 80%, subject to the $200 calendar year deductible. Again, the member pays the cost of the drug and submits for reimbursement through Optum, and they may be dispensed for up to a 90-day supply. Tier 4 drugs are high-cost, life-sustaining medications. These medications have been pre-approved to process at the 20% member responsibility at the pharmacy. These medications are not eligible for reimbursement. Specialty drugs. Like Tier 2 and Tier 3 drugs, they are covered at 80% after reimbursement and also subject to the annual deductible. Many specialty medications must be filled at Optum Specialty Pharmacy, and there is a 30-day supply max on these medications. There are a few important things that you need to be aware of. The list of covered drugs, or formulary, is available on our website. A prior authorization is required for coverage of drugs that are not listed on this formulary. There are no benefits available for drugs that are obtained at non-participating pharmacies. Many specialty drugs may only be dispensed by calling Optum Specialty Pharmacy. Mail-order drug benefits only apply to specialty drugs. For units that have elected to provide dental coverage through Blue Cross and Blue Shield of Alabama, these benefits apply to you. There's a $25 annual deductible per member with a maximum of 3 deductibles per family. Diagnostic and preventative services are covered at 100% with no deductible. This would be your twice-yearly cleaning visit. Basic and major services are covered at 50%, subject to the $25 deductible. Orthodontic services only apply to dependent children under the age of 19. They are covered at 50%, subject to the deductible, and they are limited to a $1,000 lifetime maximum per person unless deemed medically necessary. There is an annual benefit max for members over the age of 19. If you're under the age of 19, there is no max benefit. See the plan's dental plan book on the local government website for detailed benefit information. In an effort to help our members become healthier and to identify areas where they may be at risk, the local government health insurance board has established the Worksite Wellness Program. Employees and non-Medicare retirees who are enrolled in the local government plan, along with their covered spouses, are eligible to participate in an annual wellness screening during the wellness qualifying period. The current wellness qualifying period is November 1st, 2021 through October 31st, 2022. Wellness screenings are provided at the Worksite. You can also have a wellness screening performed at the county health departments or at your primary care physicians, but a copay may apply. We have a network of pharmacies also available to perform free wellness screenings. You can log on to www.lghip.org to see a list of network pharmacies. There are 2 health and wellness programs that I want you to be aware of. Virta Health is a program that has been shown to help reverse type 2 diabetes without the use of medications or surgery. Wonder Health is a separate program that teaches you how to lose weight by changing how you eat, not what you eat. Both of these programs are free for eligible members. Let's learn more about these programs.
They told me I'd follow in my mother's footsteps. She died young from diabetes. That terrified me.
I was in constant pain, especially in my feet. I didn't know if I was going to be able to carry on doing my job with the pain that I was suffering from.
I was diagnosed at 27 with diabetes, and shortly after that I was put on insulin. For me, that was scary.
They told me the best way to help my patients was to prescribe more medication. We see their health getting worse. There has to be a better way.
They tell us all these things about what living with diabetes is all about.
What living with diabetes means.
But they're not true.
with the current standard of care or just managing disease. There's a real solution for this epidemic, and people should know about it.
My job is to provide benefits and save the company money. I now have a life-changing solution for our employees and their families.
I'm not on insulin anymore, and it's a very big deal. Can't wait to see what's next.
I'm better at my job than I was 10 years ago. I don't deal with the constant pain, and I'm putting the young guys to shame.
So now I'm keeping up with my grandsons, and I'm eager to see what life has in store for me. I got teared up.
Welcome to Wonder, a world where weight loss is a science, not a diet, where you don't have to live on kale salads or hit the gym every day. No points, plans, or counting calories. You'll have the freedom to eat your favorite foods. You'll lose weight, sleep better, stress less, and more. And it could be at no cost to you. From our welcome kit to 24/7 support, our online community, and our 100% digital program, you'll learn clinically proven skills that retrain your brain. Our weekly on-demand masterclasses are an eye-opening perspective on better health. You'll learn things like the science of eating pizza or catching your besties ever, all taught by our renowned team of doctors and clinicians. And whether you love burgers or sushi, no matter what your background is, or where you are on your journey to better health, Wonder can work for everyone.
When I joined the Wonder program, I didn't think it was going to be so cool.
I lost 61 pounds, but I've gained a ton of perspective on life.
Sometimes you do things out of habit. This program really helped me to look at it from a different way, to look at it as a behavior, to modify.
I'm a much different person. I'm more confident. I'm not depressed.
Getting me into a healthier lifestyle actually helped me clear my head. It affects everything else.
Practicing these skills has helped me manage the stress levels.
I have a family at the firehouse. I have a family at home, and now I have another family.
So this program really saved my life.
It's time for a weight loss program that not only works, but goes beyond the number on the scale. Expect to run after your kids without running out of breath. Expect to live your why. Expect to have more pep in your step. Expect to be supported like no other. Expect results that actually last. Wonder. Expect it.
Thank you for listening today. I hope that you have found this information helpful. I also hope that you have a better understanding of the plan's benefits and programs and how you can apply them to yourself and to your employees. Feel free to contact me if I can ever be of assistance. Thank you again.